Hi everybody. I want to go over another very common question I get, and that question is, does the treatment hurt? Okay, I understand that. Nobody with headaches and migraines wants to do some treatment that is going to make their pain worse, or is going to hurt during the process. So I'd like to talk about what that is. Now, your brain needs two things to survive: fuel and activation. If we're going to fix a misfiring in the brain that's causing these headaches and causing these migraine problems, we've got to get that brain to start working as it should. And we've got to start giving it the fuel that it needs. Again, it needs fuel and activation. So that's what our treatment is going to revolve around, is that fuel and activation to get your brain to start working as it's supposed to. So let's talk about first the fuel. Okay, fuel comes in the form of glucose and oxygen. Every treatment that we have in the office with you, correcting a headache or migraine problem, is going to be involving oxygen therapy. We use what's called an oxygen concentrator. You just lay back, we put some moist hydrocollated heat on your back. That's like a 180 or 170 degree steam heat that we put on your back, and it's just like a really soothing, deep heat. And while you're on that, you're just laying back and you're breathing in this 90% oxygen, getting your brain the fuel that it needs. The other part of the fuel is glucose. Your body gets glucose from the foods that we eat. And one thing that we have to make sure of if we're going to correct this problem is getting your body on the right foods. Now again, that's not hard to do. Our doctors and myself will just help guide you in the right type of diet. Just saying, hey, you need to add these things and subtract some of these things. And that's going to help your body to heal. Activation is another thing that our brain requires to function properly. Now, for activation, we use a small tool called an activator. Okay, it's just a little instrument. We put it in different areas where your nerves are misfiring. It's just a little click. That's all you hear, a little click, click, click. There's almost no pain at all with that procedure. Most people don't even really feel it. Okay. Another thing we use is called laser therapy. We put lasers over areas where the neurology isn't working like it should. The brain, the spinal cord, the nerves, where it's not functioning properly. It may be inflamed where those nerves are. So we put lasers over those areas, and it's completely painless. You don't even really know they're on there, but we can see the lasers going into the various nerve regions. The last thing that we'll use very commonly with our treatment in correcting migraines and headaches is spinal decompression. Decompression is where we lie the patient on a what's called a DRX 9000 table, and that just gently opens up the different discs in the spine that are being compressed. If a nerve is being pinched, it's going to cause pain. If that pain goes into different areas of the body, it's going to cause a headache, okay, or a migraine. So decompression helps relieve that pressure, opens up those nerves, and helps again with our corrective process. And again, it's very relaxing. Most patients, when I go in to check on them while they're on spinal decompression, are asleep. They're completely resting. So there's some information on does the treatment that we do hurt? There's virtually no pain at all. Most people, again, are sleeping or resting through most of the procedure. Thank you guys for watching this video, and I hope that helps you. Hope to see you soon.